Hi everyone. Today we just wanted to do a question and answer session to explore more around the support which HCA Healthcare can offer student nurses into their training and around the private healthcare sector and the key differences around the private healthcare sector, the private sector, sorry, versus the NHS. So today we have Jan Stevens, who is the CNO at the Wellington Hospital with us, to give a bit of an overview about the support which HCA can provide student nurses across the HCA group. So thank you very much, Jan, for joining us today. Are you able just to give us a bit of an insight into your role at HCA?
Yeah, sure. Well, first of all, welcome to this Q&A session, and I'm really pleased to be able to share some of the things and my experience at HCA, because I joined 3 years ago. So a little bit about me. I've worked in the NHS for over 40 years, and at probably every level of the NHS, which for me is, as student nurses embarking on your career, is one of the amazing things about our profession, in that you can do so many different things, and I've managed to do that working as an ED nurse, to a matron, to a chief nursing officer, to go to the Department of Health Education England, troubleshooting in hospitals for quite some time, and then after 40 years I retired. So amazing career, I've had a good career that I'm really proud of. Took a few months off and then got bored, so got headhunted to this role at the Wellington Hospital as the chief nurse. So what's the chief nurse do? Well, I'm a part of the executive team in terms of setting the direction of how we're going to run our hospitals and the standards that we're going to work to. And obviously I'm accountable for nursing practice, for professional standards, for clinical governance, risk management, and I manage a few other bits in here as well, like I oversee our resident doctors, and actually also oversee pharmacy. So I've got a really varied job, and really actually only came for a few weeks, and I've now been here 3.5 years. So must say something about why I really love this place.
That's great. Thank you very much, Jan. Can you tell us how you found the transition from the NHS to working in the private sector?
Yeah, it's really interesting, that one, because if I'm being honest, I was really sniffy about the private sector. I used to think the private sector just did all the easy operations and simple things that that the NHS well still do, but yeah, that they just did the easy stuff, and it wouldn't be that interesting. And actually, if you do look at the private sector, there probably are a lot of hospitals that still do just basic hips and knees and cataracts and relatively simple procedures. But when I was approached to come to work at HCA, first of all, probably a bit like you, I'd never heard of HCA. And actually HCA is actually a group of hospitals, mainly in London, although we have got one in Manchester and we're going to open one in Birmingham in a year or so. But it's really prestigious London private hospitals like the Wellington, London Bridge, Lister, Harley Street, Princess Grace, and sorry if I've forgotten any of the others, but we're a group of really complex caring hospitals that totally transformed my whole view of what the private sector was about. What I hadn't realised till I came to work, till I was approached about this job, that our sector at HCA UK offers everything. We do urgent care, we've got an acute assessment unit, we do cardiac, all really complex specialties. My hospital, for example, has got 26 intensive care beds across 2 sites. So you're actually seeing some amazing surgeries and treatments and diagnostics that are actually performed by some of the internationally renowned surgeons and physicians, and you get to be part of working like that. So that was, recognizing that was really fabulous, and I was really drawn to coming to work at within an organisation that offered those things. In terms of its similarities and difference, much of it is very much the same. As a nurse, we are here to nurse, to deliver the highest standards, and that's no different. I think it was far less different than I thought it would be. But there are some really, really amazing differences from the NHS, which for me is, if you think about all the hospitals in the NHS, fundamentally they're all incredibly large, where the hospitals that are within our group are much smaller, but they do a lot of different things. So they have a really different feel, and that was the thing that drew me to want to stay at this hospital. And I think what people say they love most about working within our company, it has a kind of small hospital feel, in the sense of it's very, very friendly. Everybody knows everybody. It's very welcoming when you come in. All our hospitals have a feel that you think this is a really nice feeling. So you know the staff from across all the various specialties and services that we have that provide services for patients. I think the big difference is it's so busy in the NHS and it's so under pressure that it feels, and it felt to me, that it's just like you've just got to get through the day. And we're here, whilst we're often we're often busy, what you have is different staffing ratios. So we, without doubt, have better staffing ratios. Yep. I know some of my nurses might sometimes say that it's busy, but when you're dealing with a ratio of 1 to 4, 1 to 5 in our areas, sometimes 1 to 3, depending on our acuity, then you're talking about having much more time to spend with patients and an expectation of delivering excellent care. Now, I know that we want to do that in the NHS, and many people deliver outstanding services, but you actually feel that you've got enough time to do that here. And that's a big, big difference when you move from the NHS to the private sector. We actually celebrate examples where nurses have gone above and beyond, where they do that little extra for patients. They'll go and get something from the shop from them, or just very different things. And so that feels very different, and for me, a really, really, really positive thing. You'll also see a difference in that leaders are much more hands-on. So, when I was chief nurse at one of the London hospitals, I had 100 wards. Here I have 8. So I know everybody. I can get round to see those. So you'll see leaders rounding very regularly and getting to know staff and what the issues are. So it's a really, really great opportunity and a fabulous place to work.
Great, thanks very much, Jan. Obviously, as you know, HCA Healthcare takes on fairly large cohorts of student nurses from local universities currently. Can you tell us how your students are supported during their placements at the Wellington?
Well, the feedback that we get from our students is really, really great. I haven't come across a student yet that said anything other than a fabulous experience. And often students that come maybe in their second year, we are now taking first year students, will want to come back and have their final placement with us because they have such a positive experience. We review our feedback and what they talk. I'll tell you what students tell me, which is they feel incredibly supported. They do actually have time to spend with patients, and for me, having that opportunity to spend more time with a patient, to get to understand their physical, psychological, social needs, and actually not feel rushed, is one of the things that our students like. So we want people to spend time, and students, obviously in their supernumerary way, can actually be with patients and really understand what proper holistic care is, and are encouraged to really take time to understand that and benefit from that. The like the NHS though, there's similarities in that you will have you'll have a assessor, there'll be supervisors around. We have practice educators who work directly with our students, so it feels kind of like a very personal experience. It's a good learning environment, and our nurses are good assessors, and who will take time with you to go through your learning things that you've got to get done. It's flexible in that you'll be able to follow patients through. So if you want to go down to our acute assessment unit, see a patient onto our medical unit, and or etc., then that's really easy to do. So we want to provide an amazingly good student experience, because quite frankly, I want you to want to come back and work at our hospitals at the end of your 3 years training. So we want to make it best, because we want you to realise that there's an amazing opportunity and a great career to be had within the private sector. So I know that I look for the experience because I meet every student nurse. We have sessions in our boardroom so that I can understand how experience is going, whether there's things we could do differently, but just generally to make sure people feel that they are welcome and supported during their experience.
Great. So that takes us quite nicely on to our final question. What opportunities are there for new qualified nurses at HCA Healthcare, and how are they supported when they first join the team?
Well, I think one of the things that I didn't say last time around our student nurses coming is our student nurses are all offered the opportunity to go onto our bank. And banks are really, really great way to get experience and obviously earn money. So actually, what we often find is our students in the 3rd year placement will join our bank, and actually, hopefully, if they pass their assignments and they live the values of our hospital, then we will help them get into employment. So we do the same as you would expect of any new qualified nurse, which is you have proper induction. Every newly qualified nurse gets a competency. We've got a kind of booklet that takes you through all the things that you've got to learn over your preceptorship period. You will be supported by one of our practice educators to help you get through those competencies. So there's a kind of proper preceptorship period. We can do the same things as the NHS in terms of offering flexibility. So if somebody doesn't know whether they want to work, we can do 6 months in medicine, 6 months in cardiac. We've had examples where nurses wanted to work in ITU, where they've started on one of our surgical floors and then after 6 months moved. We even started people in intensive care, although most nurses like to start somewhere else. So we can do that kind of rotational thing, but actually on a quite personal, bespoke level. The same things like flexible working. There's lots of opportunities for learning. We have a learning academy, so there's lots and lots of online material so if you are keen and want to learn, there's a plethora of material that you can use without even going on courses. So for a learning experience in that preceptorship period and beyond. And then of course, if you qualify, we want people to have a career through the HCA hospitals. So people will find that they can move between, say, the Wellington, but they want to then go and get some experience at London Bridge or at one of our other sister hospitals. So it's great for new nurses, but it's also an amazing career. I've got student nurse actually who came to her 3rd year. She qualified, and she's working her way up at the moment. She's just become a senior staff nurse, and she only qualified I think about 18 months ago, Jackie. So yeah, so it's a fabulous place, really. I can't recommend it highly enough.
Great, thank you very much, Jan. Thank you very much for your time. It's been really interesting to hear more about the journey which student nurses can take with us. We hope everybody that's joined us has found this Q&A session useful. To find out more around what it's like to work in the nursing nursing in the private sector, or to find out more about the opportunities for newly qualified nurses, please email our careers website. It's careers@hcahealthcare.co.uk, or my colleague david.fitzgerald at hcahealthcare.co.uk, and they'll be able to give you more information about the opportunities we have available.
Okay.
Many thanks.
Bye. Have a great afternoon, morning, or wherever it is. Take care. Bye bye.